I'm Dave Fields. Live here in Morganton, up the road about 5 miles. I work at the bakery in Valdez. I've been here, 2.5 months I've been coming here. I graduated 2 weeks ago on Tuesday, and it's been a long, drawn-out process. I worked that week, it was kind of rough. I felt kind of funny, that last day I worked 3 12s and 1 6. And that last day on Wednesday, I started feeling really sick, real lightheaded and dizzy and couldn't catch my breath, and I finished the day and went to the hospital, and they wouldn't let me go home. They checked me right in. I parked up there across from the emergency room door, and I walked from there into the check-in, and it took me 5 minutes to catch my breath. It probably weren't, less than 50 yards from my car to the front desk. And they took me out there and took me straight upstairs, and I was there for a whole week. I said I went from COVID to what they called COVID pneumonia. And with my COPD, it put a hurting on me. I sat at home for almost 3 months. I couldn't walk from here to the copier machine, and I'd be out of breath. I'd have to sit down and catch my breath, and felt horrible. Well, actually, my doctor, Dr. Scott Scroggins over in Valdez, he suggested I come here. He said they might be a lot of help for me. And I believe it's the best thing that ever happened to me, to be honest with you. When I first came, it was real rough for me. Like I said, the walking that was like my worst enemy. At the time, I think I could do the steppers and a little bit better than I could the walking part. It just seemed to be, take the wind out of me just so quick.
When Dave first came, we do, as part of the admission criteria, we do a 6-minute walk test, and that is just how much distance that you can cover in 6 minutes without resting. So Dave wasn't even able to make it that entire 6 minutes. We had to sit down several times.
Yes.
We had to increase his oxygen. He was on anywhere from 4 liters to 6 liters when we first got here. So the 6-minute walk test was a little rough for him.
Real rough.
By the end of the program, so Dave came 2 times a week for 36 weeks. Mm-hmm. And so by the end of the program, Dave was able to walk that entire 6 minutes with no oxygen, with no rest. He improved his score by 72%.
I've listened to the girls here and done what they've asked me to do, and I started walking at the Greenway over here in Morganton by the river 4 miles a day every day on my days off. The days I don't work, I still go to Greenway and walk, and I've really never been much on walking, but to this, I've really started enjoying walking, to be honest with you. You get to know the people over there, the regulars that come every day, and it's been a real good thing for me. Just like coming here, it's been a really great thing for me. I think it'd be best for anybody that's got any health problems whatsoever. There's a lot of people out here on the floor that are a lot worse than me. You come in here every day, they're always open, upbeat, and you couldn't ask for better people.
So when Dave came to us, we knew that he worked at the bakery. We knew he had a very strong physical job. And so the exercise prescription that we gave Dave, we really wanted to emulate what he does at work. So he's pushing hand trucks, a lot of bread things. He's having to bend down on dollies. He's having to lift heavy things, put them in different places. So we really made his exercise prescription emulate what he's doing in his real life, because that was one of Dave's biggest goals. He wanted to get back to work. I just want to say to any of the patients out there that have had COVID, or if you're dealing with any type of respiratory or heart issue, Dave's story is one of dozens and dozens of stories. We do this every day. Stories like this happen every day. Dave is just a regular person just like you, so don't be afraid to come into our program. We're going to take good care of you. We're going to start you out at a level that's good for you, so please come see us if you're having issues.